Antibiotics. They are much modern medicine. Use them to cure infectious diseases, but also facilitate safely in everything after the surgery, chemotherapy, organ transplants, and other medical surgeries or treating diseases. Without antibiotics, they can lead to life-threatening infections. And, in fact, we are at risk of losing the effects of antibiotics to some of the diseases.
Antibiotics are chemicals that prevent the growth of bacteria. In some situations, unfortunately, some bacteria and viruses have become resistant to all currently available antibiotics, and at the same time, the world has stopped to discover new ones.
But wait, we can rid of getting worse of the problem. But first, we must know how did we get into this kind of risky situation. Way back 1928, Alexander Fleming was discovered the first antibiotic called penicillin. But in his acceptance speech in 1945 Nobel Prize, he warned that the bacterial resistance had the potential to ruin the antibiotics.
And he was right. In the 1940s and 50s, the bacteria had already begun to resist the antibiotic, and until now, the antibiotic resistance is widely known for some bacteria that resist them.
Why does antibiotic resistance is a public health issue? It is a growing public health concern worldwide. When a person is infected with an antibiotic resistance bacterium, not only is treatment of the patient more difficult, but the antibiotic resistance bacterium may spread to other people.
When antibiotics don't work, the result can be longer illnesses, more complicated illnesses, more doctor visits, the use of stronger and expensive drugs, and more deaths caused by bacterial infections.
Examples of the types of bacteria that have become resistant to antibiotics include those that cause skin infections, urinary tract infections, meningitis, sexually transmitted diseases, and respiratory tract infections such as pneumonia. Let us know now what are the main causes of antibiotic resistance that became a worldwide problem.
Here are the main causes of antibiotic resistance. First is overprescriptions of antibiotics. Antibiotics strictly target bacteria, but it is sometimes difficult to differentiate between viral and bacterial infections without costly tests. It is often less time-consuming and more cost-effective to proactively prescribe antibiotics, rather than take precautions and prescribe only the correct treatment. Next is patients not finishing the entire antibiotic course. Another issue with antibiotics is the inability to monitor patient intake. Antibiotic dosages are designed to eradicate entire populations of the pathogens. When antibiotics are not taken for the entire prescribed course, pathogenic bacteria can adapt to the presence of low-dose antibiotics and eventually form a population that is completely resistant to the antibiotic regardless of the dosage.
Overuse of antibiotics in livestock and fish farming. Antibiotic usage is also not exclusive for humans. Every day, antibiotics are used to treat livestock and fish to prevent infections. Similar to overuse in humans, uncontrolled use of antibiotic create a reservoir of bacteria that could become resistant, thus rendering the antibiotic useless. Poor infection control in healthcare setting and poor hygiene and sanitation. As a result of cities becoming more densely populated, people are exposed to more pathogens all the time. Hospitals and clinics are seeing more and more patients with infections, and it is not always possible to curb the spread of a pathogen in a population. Absence of new antibiotic being discovered. Finally, one of the last contributing factors to antibiotic resistance is the lack of new antibiotics being developed. Following an unprecedented number of antibiotic discoveries in the last 40 years, the number of antibiotics being identified has slumped to an all-time low. Without new drugs to combat the ever-increasing number of antibiotic resistance, society is running out of options in the treatment of infection.
Now, we must know the four core actions to prevent and minimize the antibiotic resistance. First is preventing infections, preventing the spread of resistance. Avoiding infections in the first place reduces the amount of antibiotics that have to be used and reduces the likelihood that resistance will develop during therapy. There are many ways that drug-resistant infections can be prevented, such as immunization, safe food preparation, hand washing, and using antibiotics as directed and only when necessary. In addition, preventing infections also prevents the spread of resistant bacteria.
Next is tracking. CDC, or Centers for Disease Control and Prevention, gathers data on antibiotic resistant infections, causes of infections, and whether there are particular reasons or risk factors that cause some people to get a resistant infection. With that information, experts can develop specific strategies to prevent those infections and prevent the resistant bacteria from spreading. Next is improving antibiotic prescribing stewardship. Perhaps the single most important action needed to greatly slow down the development and spread of antibiotic resistance infections is to change the way antibiotics are used. Up to half of the antibiotic used in humans and much of the antibiotic used in animals is unnecessary and inappropriate and makes everyone less safe. Stopping even some of the inappropriate and unnecessary use of antibiotics in people and animals would help greatly in slowing down the spread of resistant bacteria. This commitment to always use antibiotics appropriately and safely, only when they are needed to treat diseases, and to choose the right antibiotics and to administer them in the right way in every case is known as antibiotic stewardship.
And number 4, developing new drugs and diagnostic tests. Because antibiotic resistance occurs as part of a natural process in which bacteria evolve, it can be slowed but not stopped. Therefore, we will always need a new antibiotics to keep up with resistant bacteria as well as new diagnostic tests to track the development of resistance.